Promoting better health for mothers and their babies. We will take a look at the theme of World Health Day. Hello, I'm Anand Naidu and this is The Heat. A new report from the United Nations agencies shows that women today are more likely than ever to survive childbirth, but they warn progress could be undone due to widespread cuts to aid. The UN released its mortality report on Monday, World Health Day, kicking off a year-long campaign focused on the health of mothers worldwide and their newborn children. Mitch McCann reports from the United Nations.
The joint report, titled Trends in Maternal Mortality, is the result of a collaboration between UNICEF, the World Health Organization, and the United States Population Fund. It found that between the turn of the century and 2023, there was a 40% drop in maternal deaths globally, largely because of better access to health services. Despite the overall improvement, it says progress has slowed since 2016. An estimated 260,000 women died in 2023 due to complications from their pregnancies or childbirth. The report also puts a spotlight on inequalities between different regions. Only 3 regions made significant progress in reducing maternal mortality in the past decade. The 3 being Sub-Saharan Africa, Australia and New Zealand, and Central and Southern Asia. The report came with a warning that the world isn't meeting the UN's 2030 Sustainable Development Goal target for maternal survival. Right now, the annual rate of decline worldwide is around 1.5%. To meet the UN's target, it would have to be 10 times higher. UNICEF's executive director says global funding cuts to health services are putting more pregnant women at risk, especially in the most fragile settings. The report did not mention the new US administration specifically, but the White House has dramatically reduced funding to world bodies, including the UN. In one of his first executive orders, President Donald Trump stated he intends to pull out of the World Health Organization altogether. Mitch McCann, CGTN, New York.
To talk more about the efforts to reduce women and babies' mortality, we welcome Dr. Allisyn Moran. She heads the Maternal Health Unit at the World Health Organization. Dr. Moran, thanks so much for joining us.
Thank you. Thank you so much for having me today.
Okay, let's start with your main goal, which is, of course, to reduce the number of maternal deaths, babies' deaths as well, to 0. There have been significant gains, but a reduction in financing is threatening to reverse those gains. So what is your assessment of the situation right now, and what needs to be done to fix it?
Great. Well, thank you so much for the question. And we're really pleased to be able to be here today to talk a little bit about our year-long campaign to really reduce maternal and newborn mortality and improve well-being and health for women in general, with the theme of healthy beginnings, hopeful futures. So as you noted, we've seen a 40% decline and about a 30% decline, a 40% decline in maternal mortality and a nearly a 30% decline in newborn deaths from the year 2000 to the year 2023. But we've really seen that these reductions have slowed down since 2016. So the rate of reduction has slowed quite a bit. So now we're really plateauing and we have a lot more work to do so we can achieve the Sustainable Development Goals by 2030. And then, as you mentioned, this is further exacerbated by the current financial crisis and the reductions in ODA and funding to support especially the most vulnerable countries and settings.
Yeah, is it just a reduction in financing that have caused the reduction that you talk about, or other factors as well?
Well, the reductions over the last 2 decades or so have been caused by a variety of factors. And so there's been a lot of improvements actually in access to services and quality of services. But now we're at a level where we've plateaued since about 2016. So we really need to think about what we can do to accelerate progress and further reduce mortality, and especially in this current environment where now we're seeing funding cuts and reductions in financial resources. We have to really think about what we can do faster together to make a difference for the most vulnerable, which are women and babies.
Right. I was looking at some figures from the World Health Organization. They're very disturbing. It says that close to 300,000 women lose their lives during pregnancy or childbirth each year. At the same time, over 2 million babies die in their first month of life, and about 2 million more are stillborn. Um, Those are significant numbers. What are the root causes of what we are seeing here? And does it also depend on women's access to things like nutrition, to water, to healthcare?
Yeah, thank you very much. It's an excellent question. And as you cited, the numbers are still quite staggering. They've reduced quite a bit, but still we have almost 4.5 million lives that are lost every year between women during pregnancy and childbirth, babies in their first months of life, as well as babies that are born stillborn. So there are a variety of different factors that lead to those large numbers. As you mentioned, a lot of nutritional elements, women starting pregnancy with anemia or other pre-existing conditions like hypertension and diabetes that may get exacerbated and cause poor outcomes during the pregnancy itself. Access to quality care is a huge issue, as well as respectful care where women can feel like they're listened to and have their concerns addressed. So we also know that there are many issues even beyond just surviving childbirth, going into larger health issues in terms of suffering from mental health issues after birth, as well as some of the longer term disabilities or health problems that occur after pregnancy that impact a woman's life for many, many years to come.
And was any of this aggravated or exacerbated by the COVID pandemic on the one hand, and now we're also seeing the rise of measles in many parts of the world?
Yes, no, definitely. Well, the figures that we have been citing are for the years 2000 to 2023. So they do include the years of the COVID pandemic. And we did see that during the COVID pandemic, we had an increase in maternal deaths in 2021, which really mirrored the pattern of excess deaths among women of reproductive age in 2020 to 2021. But then once that sudden and unexpected shock of COVID passed, maternal mortality went back down to consistent levels in 2022. So we definitely did see an impact of the disruption of services due to the COVID pandemic.
Now, maternal health is part of the United Nations Sustainable Development Goals. The goal is to reduce global maternal mortality, the ratio that is, to less than 70 per 100,000 live births. And based on current trends, 4 out of 5 countries are not on track to meet those goals, those Sustainable Development Goals. 1 in 3 will fail to meet the target for reducing newborn deaths. I mean, how concerning is that to you?
That's very concerning, and that's why we're excited to have the opportunity to really talk about this and raise awareness during World Health Day this year. As you said, 4 out of 5 countries are off track to meet the Sustainable Development Goal for maternal mortality reduction, which is a global average of 70 deaths per 100,000 live births, and 1 in 3 are off track for the newborn Sustainable Development Goal. So we're really working with partners through a variety of different mechanisms to think about, we know what works, so we really need to work better with countries and with our partners to prioritize evidence-based life-saving interventions through access to quality care that can make a difference and continue to drive down mortality. Our challenge is going to be accelerating progress. We have to run a lot faster to be able to achieve those goals, given that progress has really stagnated since 2016 for a variety of factors.
So, Dr. Moran, on the one hand, you're dealing with things like the provision of medicines, nutrition, clinics, providing healthcare, etc. But where does education fit into this?
Yeah, very good question. I mean, the broader social determinants of health, such as education, nutrition, access to health, wash services, water sanitation within healthcare facilities are really essential. We know we have evidence that in countries where a female education, especially female education, is high, it is a driver of reducing maternal mortality. And it helps to improve gender equality and women's empowerment with their essential functions to really help drive down maternal deaths.
And how important is primary healthcare in alleviating the problem?
Primary health care is essential. Women's and children's health is really the backbone of the primary health care system. So it's essential. Many countries are investing in improving primary health care, so that's an essential piece. And maternal child health are a part of those benefits packages. The essential piece as well is to have um, linkages between the primary healthcare system and the secondary level hospitals that can provide life-saving care in the case of emergencies, both for maternal emergencies such as cesarean section and blood transfusion, as well as for care for small and sick babies and small and sick newborn care units at a secondary level. So that as well as linkages to a tertiary or intensive level facility as well that can provide more intensive care for those with, very serious complications that require round the clock and intensive care.
Now, you have worked for the United States Aid Organization, USAID. You've worked there before. That's the organization that extends assistance to countries for global health, disaster recovery, alleviating poverty, and things like that. Now, recently, of course, as we are fully aware, that kind of aid has been frozen by the new administration. How will it affect programs like the one we're talking about?
That's a very good question. And there's been a lot of discussions and studies that have been done to try to address this issue. We know from the maternal mortality report that during the COVID time, which was a similar situation where you had a sudden and unexpected shock, external shock to the system, that it was a huge disruption to essential services. And so women had difficulty accessing quality antenatal care, delivery services, as well as postnatal or newborn care services. And we did see increases in the number of deaths during that period. So we are heard, informally from our country colleagues, as well as reading the variety of studies that have been published on this since the U.S. government freeze, that there have been service disruptions in maternal and child health. But in terms of the long-term impact of that, we are waiting with others to start looking at those types of analyses moving forward.
Dr. Allisyn Moran, thanks so much for joining us.
Thank you so much for the time, and please do join the campaign for healthy beginnings, hopeful futures. Thank you.
Okay, time to bring in our panel. Joining us from Alexandria, Dr. Kate Tulenko is founder and CEO of Corvus Health. From New Orleans, Dr. Anita Raj is Executive Director of the Newcomb Institute and Professor of Public Health at Tulane University. And Dr. Zulfiqar Bhutta is Co-Director of the SickKids Center for Global Child Health. He joins us from Toronto. Welcome to all of you to the show. Zulfiqar, let me start with you. There was a study done by the Lancet Global Health Group which showed that in 2020, the average in the world was 223 deaths per 100,000 live births. The Sustainable Development Goals that we've been talking about is for 70 in 100,000. That's a reduction of a third. That's that reduction to be met by 2030. Can it be done?
Well, theoretically, yes, although it will require reducing maternal mortality at an average rate of around 11% per annum now in the remaining time available for these Sustainable Development Goals till 2030. But as you know, the best laid battle plans don't survive the first contact with the enemy. What we had in the period since the 2015 Sustainable Development Goals were set was a big interruption due to COVID-19, big economic downturn following Ukraine and other conflicts globally. So there has been a setback in terms of how countries could finance and focus on reducing maternal mortality. But all hope isn't lost. I mean, I do think it is doable for certain high burden areas. The good news is that we have made progress globally, and there is not a single country now with a rate of maternal mortality in excess of 1,000 per 100,000 births that we had not all that long ago. So to answer your question succinctly, progress is possible. Maybe we may not be able to get to the global target by 2030, but some countries that really need to make progress can. And if we were to get to that target, we would need to start with greater focus and energy now. And if we don't get it by 2030, we certainly can get it by 2035.
Anita, sub-Saharan Africa and Southern Asia together accounted for 87% of global maternal deaths in 2020. I mean, clearly, developing countries are in most need here, in most assistance. What is your assessment of the conditions in these countries that lead to these high levels? Do we have enough data? Do we have enough in terms of healthcare surveys, etc., that would tell us more?
So yes, we have wonderful data at this time to show the progresses we've made on maternal mortality, as Zulfiqar said, and that has been, truly substantial. It's important to have the programs and it's important to have the data. As was already mentioned, we took a great hit with issues of maternal mortality through COVID, but the data that we have on hand are good. Unfortunately, our most important data, our demographic and health survey data done across 90 nations, has been cut as part of the United States cuts for the USAID program here. We have the demographic and health survey that helps guide us in terms of our understanding of maternal mortality, infant mortality, but also those factors that affect maternal and infant mortality. And these include, are you getting antenatal care? Was there a facility delivery? What is your proximity to health services? What is your access? The things that we have been really working to ensure, we've been working on with health system strengthening to ensure people are getting the health care that they need. I think it's really important to remember that maternal mortality is not only compromising the health of women and children and the productivity of societies, it's a major indicator. It's a major indicator of compromised health and development of societies, but it's a major indicator of how we treat and value women in our society. So we have made advancements, but there are countries where we have seen declines. The United States, where I live, is a country where we've seen declines. And with loss of development aid funding, which we're seeing from a number of nations, including my own, and with the loss of the demographic and health survey to track how progress is going, we are at risk for not continuing the advancements we've seen.
Right, and Anita, in addition to the loss of data that you talk about, demographic data, health survey data, which was caused by the cuts in USAID funds, there have been other consequences as well. Here's one official commenting on those losses. Let's listen.
If I just take the example of Afghanistan, between 2025 and 2028, we estimate that the absence of US support will result in 1,200 additional maternal deaths.
So there we heard the regional director for the US population, UN population rather, Pierre Smith. So how serious a situation are developing countries facing?
I think it's quite serious and quite concerning. I don't believe it is up to a single nation to ensure that we support these programs and that we continue these data. But I absolutely think that what we have typically thought of as donor nations, those that have the funds to provide support through international aid efforts, that they continue to sustain that. And the loss of that, the pulling back of that, is something that is going to compromise maternal survival and infant survival globally.
Kate Tulenko, we have talked so many times on this program about COVID, about the impact of COVID, about the pandemic, but we haven't talked up to now about its impact on today's subject, which is maternal health, the health of babies. What is your assessment?
The health of women and babies is multifactorial. We've spoken a lot about the need for health workers. Every delivery needs to be assisted, either by a midwife or a physician or preferably an obstetrician. But we know even in the US, 1/3 of counties don't have an obstetrician to deliver children. We know you need reproductive commodities so that women can space their births. The closer together a woman gives birth, like if she gives birth once every year, she's more likely to die, more likely to have complications. The baby's more likely to have complications. For births that are at risk, we would like them to be at facilities. So this might be a birthing center or a hospital. These facilities are very reliant on supply chains because you need the medical equipment, you need the medicines, the disposables, bandages, IVs in order to have a safe birth. So all of these cost money. So as the previous panels mentioned, with the current crisis that we're going on with the removal of donor aid, Also with probably we're going to go into a global recession with the tariffs. We have huge challenges ahead of us for maternal and child health, but there are things that countries can do. We know that there are probably 3 countries we most need to focus on. That would be Afghanistan, Democratic Republic of Congo, and Nigeria, because they have the majority, and also India too, the majority of maternal and fetal and newborn demise. So those are the countries that globally need to be most focused on, but all low and middle income countries as well can improve their outcomes. A lot of it by ensuring that people have access to safe delivery. And as far as the funding, we're going to have to find new funds, and some of that will be by getting rid of some of the leakage and corruption there is. I know in my field of health workforce, in many countries, up to 20 to 30% of health workers are ghost workers. And if you remove them, you can free up literally millions of dollars every year.
And Kate, it's such a complex problem that's affected by so many factors outside of just actually the provision of healthcare. I mean, there are things that we've been talking about, things like, you know, mental health, access to nutrition. How important are those things?
They're extremely important. So access to nutrition, this starts when a woman is in the womb. If she's malnourished, she's going to have a more narrow pelvis, which will lead to fetal obstruction, you know, more difficult labor, more likely to have her die, have the baby die. If she's iron deficient, she will have problems as well. There are quite a number of different nutritional deficiencies that can affect the health of women and newborns. So those are important. Climate change is critical. We know that excess heat is specifically dangerous to pregnant women. They're more likely to get dehydrated, which can lead to premature labor, premature birth. Also, just heat in itself can affect the fetus negatively. As well, we might have transportations with climate disasters. It might be difficult for a woman to get to a facility or get to the closest health workers. So we do see a lot of non-medical determinants in maternal health and newborn health.
Zulfiqar, there is also a great deal of concern about women after childbirth, and I'm going to go back to that study that I talked about earlier on, that one done by Lancet Global Health. It says that every year at least 40 million women are likely to experience long-term health problems caused by childbirth, problems like pain during sexual intercourse, lower back pain, incontinence, anxiety, and depression. In terms of treatment, I mean, is there a comprehensive approach to this? Are doctors attuned to these kinds of things?
Sadly, we haven't paid enough attention to the whole principle of aftercare and also the health and well-being of mothers in the medium to long term after childbirth. So one of the things that we have emphasized over the last decade and a half is the importance of the postnatal visit, for the mother as well as for the newborn. We recognize that those families, those mothers who receive a postnatal visit in the first 48 hours after birth have a significant lower risk of mortality and also a much higher opportunity or chance for detection of problems that can relate to infections, that can relate to the kind of postnatal complications that you're talking about, ease and facilitation of continued breastfeeding, of addressing many of the problems, and importantly, the recognition of mental health issues and challenges that relate to postnatal depression and also the support that many women need after birth. So now that mortality rates have begun to come down worldwide, it is important to develop a holistic strategy that looks at the integration of health and well-being with also maternal and newborn survival interventions. As my colleagues mentioned, with the emphasis that is now on polycrisis settings, on the challenges of climate change, on humanitarian disasters, it is also equally important to ensure that there is not just care alone at the time of childbirth, but also for these women and their children in the entire continuum of the first 6 to 12 months of life. So yes, I think it is very important to underscore this now, and it's time for the world to move into this area, even though it may not be a specific Sustainable Development Goal target.
And Zulfiqar, here's something else that was produced by the World Health Organization in terms of outcomes. It says that in low and middle income countries, every $1 invested in maternal and newborn health is estimated to yield between $9 to $20, leading to healthier, happier societies. What is it going to take to convince donor countries that this is a good investment for the well-being of people across the globe?
Well, it will require advocacy, and it will require convincing people that this is actually an investment in health and well-being and the economic development of countries. No country in the world has ever climbed the development ladder with an unhealthy population, with high mortality rates, with malnourished populations. And as my colleagues mentioned, the importance of maternal nutrition in pregnancy, in the pre-pregnancy period, is hugely important because a number of the consequences of maternal undernutrition and micronutrient deficiencies are evident through babies being born small and vulnerable. And we know that they have a life course trajectory of adversity as a consequence, with higher risks of not only morbidity, non-communicable diseases as they grow older, and finally, a huge risk of transference of some of those deficits in an intergenerational manner. So the importance of the health and well-being of societies is very inherently linked to the health and well-being of the mothers and women in that society. And the health of women in any given society is linked to how healthy that woman was when she was a girl child herself, how important she was in receiving attention when she was an adolescent. So one of the things that we think we need to optimize in terms of health and well-being across the life course is linking all these silos of pre-pregnancy, pregnancy, childhood, school-age children, adolescents, youth, and women as an entire continuity of investments in the wealth and well-being of populations. And that's where we need to get the best value for money for our investments.
Anita, Zulfiqar was talking there about the different silos that all have to work in concert to alleviate the problem. I was talking earlier on with the official from the World Health Organization about the need for education. What has been your experience of how important that is to have people educated in order to overcome this challenge?
I think one of the key issues, and Zulfiqar mentioned it, is our treatment of women and girls in our society. And the advancements in education and the economic opportunities that are being made available to women have improved substantially. There's some concerns because as a lot of populations have seen a decline in birth rate, they are concerned and want to actually increase births. And we have seen through efforts made by governments at the time of either wanting to diminish births or increase births, those policies can often constrain women's choice. And so I think it's really going to be important that we talk about, with education, the value of that education for women and girls' agency, control over their lives, and economic control over not just their lives, but contribution to society.
Okay, and that is where we need to leave it. Thank you to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C.